Even the term challenging behavior have been challenged because it's about who's challenged by the behavior. Is that the person, or is it those around them? And I think what we tend to talk about more these days is about stress and distress, because that identifies probably better how the person with dementia feels when they're displaying this behavior. And it's also common knowledge now that it is a way of communicate sometimes what they are feeling and is going through their mind, that they might be less able to communicate in a way that we are articulating what is happening to us. So the world that they might be living in is so confusing, and the ability to communicate that confusion might come up with behavior rather than a verbal communication. So I think in order to deal with stress and distress, or challenging behavior, or some people still talk about BPSD, behavioral and psychological symptoms of dementia. At the end of the day, you have to learn why is this person with their background and so on showing that now. Is it to do with pain? Is it the way they are communicating? Because they're in pain, but they cannot tell you they're in pain, and therefore the only way they can do that is by behaving in a certain way. Are they willing to go to the toilet? Do they understand what you're telling them? So you have to understand or try to understand why this person has suddenly disclosed that behavior. And then that will guide you more towards, if you want, treat the things that could be in the way of discomfort or disorientation, to make things better. And then a lot of understanding and support. I'm not saying that there won't be times that you're going to require, apart from psychological input and changes in the environment, there might be times that the person is so distressed that it will be appropriate to use medication. But as I said, that should be not the first line of treatment with someone with so-called behavioral problems.